Hello everyone. Today we are going to discuss about one topic, that important topic, that is adolescent vaccination. To start with, why adolescents need vaccinations? Why you are so much concerned? It is because to protect against diseases that have higher morbidity adolescent. Just like your hepatitis A, varicella, if a adolescent is suffering from this hepatitis A or varicella, then the chance of seriousness will be more. So that's why we need to protect them from all these in serious diseases like hepatitis A and varicella. Second, to boost the waning immune responses of certain vaccines administered during infancy or childhood like measles, pertussis, tetanus, and diphtheria. Recently, we have seen this diphtheria epidemic, this diphtheria surge. It is because of the waning of this immunity because of lack to give this vaccine during this COVID pandemic. Third, adolescents also need vaccines to prevent diseases that appear later in the adult life, like your cervical cancer. As we know, cervical cancer, perianal cancer, oral cancer, all these are emerging cancers, and cervical cancer is the most common cause of death in women. So we need to protect these cancers by giving a vaccination to an adult at the age of 9 to 10 years. So these are the importance of your vaccination in case of adolescence. Second, case one. Just we want to discuss. Suppose a 10-year-old girl brought by the parents for latest vaccination as they came to know about the newer vaccines from social media. Only received vaccines as per national immunization schedule. How to proceed? Then which vaccine is to be given first? At the age of 10 years, the vaccine which is most important is your Tdap. Tdap, this is tetanus, diphtheria, and acellular pertussis. Single dose of, as per guideline, single dose of a Tdap at 11 to 12 years, followed by a booster dose of either TD or Tdap. If they want to give in government setup, then TD, but in private setup, we can give Tdap every 10 years. This is most important. We have to give Tdap. Similarly, to pregnant women, at least one dose of a Tdap should be given in each pregnancy during the late trimester. We are giving 2 doses of TT. They are telling the second dose of TT should be replaced by Tdap, so that it will due to this maternal placental transmission, your newborn will be protected from neonatal pertussis. This is the importance of a Tdap vaccination. So first we have to give Tdap at the age of 10 years. Then the second dose to be given, the second vaccine to be given is your cervical cancer HPV. This one quiz: up to what age DPT can be given? DPT, capital D, capital P, capital T. Up to what age that this you are allowed to give DPT? After that, we have to switch over to Tdap. The answer is 7 years. Maximum up to 7 years. If somebody has missed the chance of giving the DPT vaccination up to 7 years, then you are allowed to give DPT. But after that, you cannot give DPT. You have to give Tdap because of more chance of reactogenicity. Next, this is SCVIP recommendation. What they are telling to adolescents, the most important is your Tdap oblique TD. If someone is unable to give the Tdap, then you can give TD at government setup. Second most important is your HPV against your cervical cancer. Third is your COVID vaccine, which we are not giving nowadays. Next, the second dose after Tdap, which is important, is your cervical HPV. As you know, both bivalent and quadrivalent vaccines were available, but nowadays bivalent is no more available in India. We are allowed to give quadrivalent oblique. Now recently they have launched this non-valent 9-valent HPV vaccine. The quadrivalent, these serotypes which they are covering are 6, 11, 16 and 18. You know, 6 and 18 are most important, causing this cervical cancer. There are 2 brands right now available. One is the Gardasil 4 and another is Cervavac. Both are quadrivalent. And Gardasil 9, which is non-valent, the serotypes which are covered by this Gardasil 9 are 11, 31, 33, 45, 52 and 58. These are the serotypes extra in addition to your 16, 11, 16 and 18. So this is important, we have to give a vaccine, that is your HPV vaccine, Gardasil or Cervarix or Gardasil 9. One has to be given. Age recommendation, they are telling after 9 years, you are 9 completed, you are allowed to give this cervical HPV vaccination. And Gardasil for the recommendation is up to 45 years, 9 to 45 years. We know if a child is coming between 9 to 14 years, then we are giving only 2 doses, 0 and 6 months. After 14 years, up to 45 years, dose schedule is 0 to 6. This we have to remember. Less than 14 years, 0 6. More than 14 years, 0 to 6. This we have to remember. Gardasil 9. This is the vaccine. This Gardasil 9 and the Cervarix, these are gender neutral vaccines. This Gardasil 9 is recommended, can be given to a boy up to 14 years. The 9 to 14 years, the dose is 0 and 6. Dose is 0 and 6 up to 14 years, that is constant. But for boys up to 14 years, you are allowed to give Gardasil 9. But Cervarix, that is another gender neutral vaccine, that can be given up to 26 years. Dose is same, up to 9 to 14 years, 0, 6, and after 14 years, 0, 2, and 6. This we have to remember. This is the guideline as per SCVIP. Other vaccine recommended as per IAP. Catch-up vaccination. What do we mean by catch-up vaccination? If somebody has missed the train, somebody has missed the opportunity of vaccination, then you catch the patient, patient and give the vaccine. That is called catch-up vaccination. If somebody has missed, then what are the other vaccines that can be given? It is not that you are allowed to give all the vaccines. We can give MMR, we can give hepatitis B, we can give hepatitis A, typhoid and varicella. These are the vaccines which can be given. MMR, as you know, 2 doses, 4 to 8 weeks interval we are allowed to give. Hepatitis B, if somebody has not given 3 doses, 0, 1 and 6. Hepatitis A, 2 doses, 0 and 6 months. They are telling after 10 years it is better to go for antibody titer if you are planning to give hepatitis A for cost effectiveness. Typhoid, single dose is sufficient, we know. Varicella, 2 doses, 4 to 8 weeks interval. These are the vaccines which, if somebody has missed, somebody has come after in the adolescent age group, we can give MMR, hepatitis B, hepatitis A, typhoid and varicella. These are the for normal immunocompetent children. In special cases, other vaccines which can be given is your influenza. 1 dose every year we can give. Japanese encephalitis JE, this is catch-up vaccination. You are allowed to give up to 15 years. PCV, pneumococcal conjugate vaccine, they are telling to certain cases like sickle cell disease, splenomegaly patients, cochlear implant, all this you can give PCV. And this PCV should be followed by your PPV, pneumococcal polysaccharide vaccine. The maximum for PPV 23 you are allowed to give maximum 2 doses. Otherwise, you will get hyper responsiveness for the next doses. And rabies vaccination, this is the vaccine for special cases. We can give to any patient exposure to a wild animal. The schedule is 0, 3, 7, 14 and 28. These are the special cases where we can give vaccines like influenza, JE, PCV, pneumococcal conjugate vaccine, pneumococcal polysaccharide vaccine, and the gap between PCV and PPV 23 should be at least 2 months or 8 weeks. This we have to remember. And other is your rabies vaccine. Thank you for listening. Please like this video, share this video and subscribe to my channel. Thank you.